Hi, my name is Ashley Vasquez, and for SDG3, I'm going to be talking about good health and well being in Chad. So, good health and well being is the third sustainable development goal, and it calls on countries to ensure healthy lives and promote well being for all at all ages. Well being is the intersection between physical and mental health. Health and well being includes many things such as maternal mortality, newborn and child mortality, communicable diseases, non communicable diseases, mental health, substance abuse, universal health coverage, sexual and reproductive health, traffic injuries, mortality from pollution, tobacco control, vaccine coverage, and national and global health risks, as well as the health workforce. Worldwide, at least 400 million people do not have basic health care. So, health and well being in Chad. Chad is one of the top countries for oil production in Africa, but very little of the revenue is put into the living conditions and healthcare of Chad. In Chad, there are 3.7 doctors per 100,000 people. This number is alarming compared to the global average, which is 141 doctors per 100,000 people. The World Bank reported that 66% of the population is living in poverty. 88% of the population does not have access to electricity. 44% of the population does not have access to clean drinking water. And the authorities have shown their willingness to achieve all sustainable development goals in order to respect the principle of leave no one behind and build a just world with lasting peace. So in this chart, it shows the life expectancy throughout the years in different countries. Clearly, as you can tell, despite all of the life expectancies going up, Africa is still well below others, as in some countries are well above 70 to over 80 years old for the life expectancy, but Africa is barely above 60. So maternal mortality ratio, this shows the ratio compared to like comparing Chad and the United States. Chad has a much higher maternal mortality rate compared to the United States. So in this one, I'm just talking, it just shows so death from HIV and AIDS, the new infections of HIV and AIDS, and then the number of people living with HIV, and this is worldwide. So, talking about some solutions to health and well-being in Chad, the first one I talked about was drones because drones can be used to deliver crucial vaccines or medical equipment to help fight diseases such as HIV and AIDS. The next one would be healthcare improvements. There are nowhere near enough doctors for the amount of patients there are. There's also awesome things that need to be done more frequently, such as Doctors Without Borders. I saw this article that said one of the Doctors Without Borders missions saw like 149,000 patients, which is a really big deal. And then they also need to increase access to medical training. They also need to manage their oil revenue because Chad is one of the top 10 oil countries in Africa, and they do make money from that, so they need to distribute their finances better um, towards improvements in housing and healthcare. The next one, the big factor for health and well-being is malnutrition. More than 2.4 million rural Chadians are food insecure. Of the 2.4 million, 428,000 are classified as severely food insecure. Some ways to help this would be agriculture production. There are special operations which help to create specific logistics and infrastructure work to improve the movement of food aid. There's also relief and recovery assistance as well as school meal programs. Overall, as shown in the previous slide, there are numerous areas to focus on when working to improve health and well-being in Chad. The country needs to refocus their revenue from oil and redirect them towards housing and healthcare. Additionally, there needs to be a greater access to medical education and training in order for there to be a comparable number of doctors to patients, not only access to training, but also medical services in general. Finally, Chad needs to focus their efforts on feeding the people of their country, as many are starving to death.